Remember, this is a tool. Using the information that was provided during the program will make you more successful. Keeping the weight off requires lifelong behavioral and nutrition changes. You will be required to take vitamin and mineral supplements for life. Failure to take the supplements could cause serious health issues. It is also necessary for you to follow with us for a lifetime. We can at that time identify nutritional or physical concerns. Exercise, changes in what and how much you eat, and behavioral changes associated with food play a part in your success. Because you will be missing a large part of your stomach, you will need to chew your food thoroughly. Remember, no nicotine after surgery. Nicotine can cause ulcer formation. Remember, no alcohol. Alcohol is metabolized quickly, and even small amounts can impair your behavior. Even one drink can cause a DUI. Alcohol also is full of empty calories and can cause weight gain. You need to start a mild exercise routine if you haven't already. We need you to walk after surgery to help prevent complications. Don't wait until you're in the hospital to start a routine. You also have been asked to start a high-protein, low-carbohydrate diet. Keeping on track with the diet will help maintain your weight. Pregnancy. If you are of childbearing years and wanting to have a baby, it is very important that you do not get pregnant after surgery until at least 18 months out from your surgery. We cannot control your weight loss during your first 18 months. Getting pregnant during this time could cause serious harm to you and to your baby. Please talk to your gynecologist before your surgery to develop a responsible contraceptive plan. Let's talk about your surgical procedures. The sleeve gastrectomy. The sleeve gastrectomy is a restrictive procedure. A restrictive procedure limits or restricts the amount of food that your stomach can hold. You will lose weight because you just can't eat as much. Your new stomach will be about the size of a hot dog. Food will travel through your new stomach from your esophagus to the duodenum. The duodenum is where most of your nutrients and calories are absorbed. Since there is no rerouting with this procedure, calories and nutrients are absorbed naturally. Your stomach makes a hormone called ghrelin. Ghrelin makes you hungry. With the sleeve gastrectomy, about 85% of your stomach is removed. Because 85% of your stomach is removed, you shouldn't be as hungry because less ghrelin is produced. With this procedure, you should lose about 50 to 70% of your excess body weight in about 18 months. So if you're 100 pounds overweight, you should lose about 50 to 70 pounds in about 18 months. The gastric bypass. The Roux-en-Y gastric bypass has been around since 1967. With this procedure, the surgeon makes a new stomach from the top 1/3 of your stomach. The old stomach remains in place. This stomach will then be called your remnant stomach. The surgeon will cut below the duodenum at the beginning of the next part of your small intestine called your jejunum. The jejunum is attached to your new stomach and the duodenum is reattached to the jejunum. The remnant stomach will continue to make digestive enzymes. The enzymes will travel through your duodenum and meet up with the food at the new connection between the duodenum and the jejunum. You will lose weight because you can't eat as much and you won't absorb the calories and nutrients as you did before because you're bypassing the duodenum. You should lose about 50 to 80% of your excess body weight in about 18 months. So if you're 100 pounds overweight, you should expect to lose about 50 to 80 pounds in about 18 months. With the gastric bypass, you are prone to something called dumping. Dumping occurs when you eat something sugary or starchy. The sugar leaves your pouch quickly and enters your jejunum. Your body's response is to send in a lot of fluid to dilute that sugar. You start having cramps, sweating, your heart races, you have diarrhea, your blood sugar drops, you feel awful. Usually you need to lay down. A small amount of skim milk, yogurt, or peanut butter usually helps with dumping. Do not drink anything sugary like orange juice with sugar or candy. This will make the problem worse. The open or traditional surgery. Your surgery can be done either open or laparoscopically. 99% of the time, your surgery can be done laparoscopically. If you had extensive abdominal surgery, the surgeon might need to do your surgery open. If you have it done open, you will have an incision about 10 to 12 inches long. The incision is closed with staples, and the staples are then removed at a later time. You are typically in the hospital an extra day. Laparoscopic surgery. With the laparoscopic approach, the surgeon places about 6 incisions into your abdomen. The surgeon inflates your abdomen with a special gas so your organs can be visualized. They place small plastic ports into the incision. Through the ports, the surgeon places the instruments to complete your surgery. The advantage of having your surgery done laparoscopically is that you will have less scarring, less pain, and hopefully a shorter recovery time. It is very important that you walk immediately after surgery to get rid of this gas. Length of surgery. It takes the ambulatory staff about an hour to prepare you for surgery. It takes the surgeons about 2 hours for a sleeve and about 3 hours or so to do a gastric bypass. You are typically in the recovery room for about 2 hours. Possible risks and complications. With every surgery, there are some risks. There could be a chance of infection, but our infection rate is very low. You could develop pneumonia, but we do preventative measures. Leaks can occur where the surgeons staple tissue together, but our surgeons take special measures to prevent and detect leaks. Blockages can occur. Typically, these occur from scar tissue formation or from hernias. Blood clots are the #1 complication after the surgery, but we do many things to help prevent them. The surgeon could damage your spleen while doing the surgery, but the odds of a spleen injury are very low. Hernias can occur after surgery. We do see them from time to time. It is very important to keep your follow-up appointments for early detection. Heart attack, stroke, and even death could occur, but the chances of these are very low. Your liquid diet prior to surgery. You will be on a liquid diet prior to your surgery. Pam will instruct you on when you will start your diet. The last 2 days of your diet, you will switch from full liquids to clear liquids. Stay away from purple or red-colored fluids during this period. The surgeon could mistake those colors for blood. You will need to purchase a 10-ounce bottle of magnesium citrate. Make sure to refrigerate the magnesium citrate prior to taking this. Around noon, 2 days before your surgery, you will drink the entire bottle of magnesium citrate. Make sure you do not have any other plans after drinking this. You will have frequent diarrhea. You will be instructed not to eat or drink after midnight before your surgery. You will be instructed to stop your blood thinners prior to your surgery. Make sure your surgeon knows all of your medications you are taking prior to surgery. Some herbal medications could cause post-surgery bleeding. Lovenox. Lovenox is a blood thinner that is given to you while you are in the hospital to help prevent blood clots. Your nurse will inject your abdomen with this medication. It could cause some bruising. Some patients might need to be continued on Lovenox even after they go home. If you have a BMI greater than 50 or a history of blood clots, you will be provided with a prescription for Lovenox at your scheduling appointment. You will want to get this filled prior to your surgery. You will be taught how to inject yourself while you are in the hospital. You will inject yourself 2 times a day for 2 weeks. If you fall into this category, and if you have a computer, please go to the Lovenox website prior to your surgery and watch the instruction video. Pre-testing visit. At your scheduling appointment, you will be ordered a pre-testing appointment. Our centralized scheduling department will call you to set up the time for your pre-testing appointment. If they leave a message, please call them back to set up this appointment. The pre-testing appointment is located on the first floor of the main campus, main entrance. Once you enter the lobby, you will notice a desk to your right. Check in there. Your pre-testing appointment will take about 2 hours. The anesthesia department will talk to you about your anesthesia, and you will sign consents. They will review your testing, and you will have some blood work drawn. If they feel you need other testing, usually it's done at the same time. You will report to the same desk the day of your surgery. Getting ready for surgery. The pre-testing team will provide you with a number to call to get your surgery time. If you are having surgery on Monday, you will call this number on the preceding Friday. If your surgery is on another day, call that number the day before your scheduled surgery. The pre-testing team will provide you with a special soap. The soap is used to kill bacteria on your skin and will help reduce infections. Do not apply the soap to your face or private areas. The soap has alcohol in it and it can burn. Do not apply any lotions after your shower. The lotion reduces the effect of the soap. Don't shave yourself. We will take care of the shave here. Shaving yourself at home increases your chances of infection. Nothing to eat or drink after midnight. No candy, no gum. Only take medications if you are told to do so. Only take them with a sip of water. Wear loose clothing when you come in the day of your surgery. Most likely these will be the same clothes you will wear when you go home. You will feel more comfortable if you wear clothes that don't rub on your incisions. Ambulatory surgery. The day of your surgery, you will report to the same desk as your pre-testing visit. You will then proceed to the 6th floor ambulatory surgery. You will be asked to change into a gown. The gown will tie in the back. No underwear on underneath. The nurse assigned to you will ask you questions about your medications and health history. She will start an IV. They will weigh you. This will be considered your baseline weight. Once the operating room is ready for you, you will be transported on a cart or wheelchair to the holding area. I will be talking to your family and to you and answer any last-minute questions you might have. Once you're asleep in surgery, your family will be notified, and usually every 1 to 1.5 hours after that. Lockers are provided to store your clothes. The holding area and operating room. The holding area is a large room outside of the operating room. Usually there is a lot of activity here. You will move onto a more comfortable bed. This will be your bed for the next few days. The bed has an air mattress built into it. Your anesthesiologist will be reviewing your chart and talk to you. Your operating room nurse and nurse anesthetist will also talk to you. Once your surgeon talks to you, the nurse anesthetist can start giving you medication. You might not even remember going back to the operating room. In the operating room, you will be moved onto a narrow operating room table and secured to the table. An additional IV will be placed in either your arm or in your neck. Remember, you will be very sedate and might not remember this. After you are totally asleep, the nurse will place a urinary catheter. You will have this catheter in until the next morning. Your surgeon needs to know how much fluid is going in and how much fluid is coming out. You will also have compression sleeves placed around your lower legs. The sleeve will inflate and deflate and help push blood around your legs to help prevent blood clots. Compression sleeves. This is a picture of the compression sleeves in place. Recovery room. You will be taken to recovery room after your surgery. Your surgeon will talk to your family after the surgery is completed. Usually you're in recovery room for about 1.5 to 2 hours. The nurses will be checking your blood pressure and other vital signs. They will be checking your abdomen and making sure you don't have anything abnormal. You will be connected to something called a PCA pump. The PCA pump is an electronic box that houses your narcotic. The box is programmed to give you a certain amount of medication in a certain amount of time. You control the pain medication by pushing a button, much like your call bell. If the pain medication is not working for you, ask the nurses for something else. This is a picture of the PCA pump. So what happens after surgery? Immediately after surgery, you will be transported from the recovery room to a floor called 8-Ashman. 8-Ashman is the floor our surgeons want you to go to after this type of surgery. The staff here has the most experience with this type of surgery as compared to other floors. You will have on your compression devices, an IV, and a drain in place. You must get out of bed that evening. This will help prevent blood clots and pneumonia. This is an absolute must. The nursing staff will assist you getting out of bed. By the next day, most patients are able to walk without help. If you continue to need help, our staff will be happy to assist you. The Jackson Pratt drain. A drain will be placed in surgery. The tubing lays across your abdomen, under the skin. At first you will have a few ounces of red-colored fluid in the bulb of your drain. Each day the amount of fluid should decrease. The goal is to remove this drain just before you go home. A small hole will exist once the drain is removed. The nurse will cover the hole with a piece of gauze, and she will apply some tape to secure the gauze. The hole will seal over in about 24 to 48 hours. Occasionally, a patient might need to go home with their drain in place. If that happens, the staff and me, the bariatric coordinator, will teach you how to care for your drain. The day after your surgery. The day after your surgery, you will be taken to the X-ray department for a leak test. The surgeon checks for leaks while you are in surgery, but wants to check one more time before they let you drink. You will drink a small amount of dye and a small amount of barium in the X-ray department. The radiologist can check for any leaks or blockages. If everything's normal, they'll send you back to 8-Ashman and you can start drinking. You will first start with water. Eventually you will be able to drink Crystal Light, Jello, and broth. Fluids should be sipped slowly. Make sure that first ounce lasts at least 15 minutes. Even if you have to watch the clock, make it last 15 minutes. Gulping will put much air into your pouch and you'll be very uncomfortable. Record all of your intake on the form provided. The form has 4 shot glasses across each hour. Each time you drink an ounce, record it. You'll need to drink 4 ounces per hour consistently before you can be discharged. Once you're drinking, your PCA pump can be discontinued and you will start taking a small pain pill. You will need to keep moving. Get up and walk. The more you walk, the more you can get rid of that abdominal gas. This also prevents pneumonia and blood clots. Get up and walk every few hours. Your Vuldyne. The Vuldyne is a device to help re-expand your lungs and help prevent pneumonia. We want you to do this about 10 times an hour. Most of you will have your television on in your room. Every time a commercial comes on, take a deep breath in. Use this device until we see you in the clinic. During your hospitalization, remember to sip your fluid slowly. Drinking too fast will cause nausea and discomfort. You will eventually increase your intake from 3 to 4 ounces per hour. You will not be able to go home until you reach 4 ounces per hour consistently. You will be tired from your anesthesia and narcotics. It's okay to take an occasional nap, but you can't sleep all the time. This is the same when you go home. You can't sleep all the time or you will not get your fluids in. Pam will be around to see you while you're in the hospital. She'll provide you with information on your next diet phase, full liquids. I will also visit you each day. I will provide education and am here to answer questions you might have. At home, only take the medications you are discharged on. Don't add any other medications other than Tylenol. Some patients don't like narcotics and have pain control with Tylenol. Tylenol is a bigger pill, and you will need to break it into smaller pieces. You will not be able to drive or operate machinery while you are on your narcotic pain medication. Typically, you will be off your pain medication by your first clinic visit. Once we see you in clinic and you are off your narcotic pain medication, you will be able to drive. You will need to record your fluid intake until we see you at your first visit. Total your fluids each night before you go to bed. This gives you a visual of how much you drink each day. Bring these sheets with you to your first clinic visit. Bring something along to drink. You'll be here for about an hour and a half at that first visit. You can shower when you go home. No tub baths. You can wash over top of your dressings. Don't remove any of the plastic dressings. Ashley will remove them at your first visit. The only dressing you will remove is the one covering the spot where your drain was. You will wash over top of the hole. Put a new piece of gauze over the top of the hole after you shower. Aide Ashman will provide you with the gauze. If you go home with your drain in place, I will go over these instructions with you while you're in the hospital. Remember, do not lift more than 10 pounds after surgery for at least 4 to 6 weeks. You can resume sex in about 2 to 4 weeks, and typically you can return to work in about 3 to 4 weeks. Over-the-counter medications. NSAIDs are a class of anti-inflammatory medications. Advil, Motrin, Aleve are some of the names associated with these medications. These medications are very acidic and can cause injury to your new stomach. Ask your pharmacist if necessary if you have questions about these medications. You have a list in your binder. Identify yourself. Once you have bariatric surgery, here at Conemaugh, an alert will be displayed on your chart. If you are going to a hospital outside of Conemaugh Health System, you need to tell healthcare professionals that you have had bariatric surgery. Having bariatric surgery should not change how we treat you. You should always be treated with respect. However, your treatment plan can change. If you are in the emergency room with abdominal pain, nausea, vomiting, etc., always tell the staff what diet phase you are on. Never allow staff to give you orange juice with sugar to treat low blood sugar. And some patients even wear medic alert bracelets to identify their history of bariatric surgery. Support group. We offer bariatric support group every month. Support group is important because it keeps you focused and gives you an opportunity to talk to other patients. Please try to attend support group.
Now we will talk specifically about the nutritional concerns for bariatric surgery. The purpose of this diet is to shrink your liver. The liver is where carbohydrate or glycogen is stored. When the liver is full, it is then converted into stored fat. When our body needs carbohydrate, it will take it from the liver storage first if you are not eating carbohydrates, and the liver will shrink because your body will use up the stored carbohydrates. The liver sits on top of the stomach and has to be lifted and shifted during surgery. If the liver is heavy, fatty, and immobile, it is much more difficult for the surgeon to see and get access to your stomach. Thus, the smaller the liver, the easier it is for the surgeon. This makes your surgery safer and can reduce the risks of complications. This diet will consist of protein shakes, broth, and sugar-free clear liquids such as sugar-free popsicles, sugar-free jello, and sugar-free flavored waters. The nutritionist will review this diet with you when you come in to schedule your surgery. There are very specific guidelines for the protein shakes you will be allowed to drink. The shakes have to have at least 15 grams of protein and cannot have more than 6 grams of sugar per serving. There is a list of brand names in your packet for examples. This slow progression will allow your new stomach to heal properly and prevent unwanted complications. The first step will be on the first day after your surgery. Once your leak test has been cleared, you will begin on a clear liquid diet. This diet consists of water, broth, sugar-free jello, sugar-free popsicles, sugar-free uncarbonated waters, and decaffeinated tea. The dietary department will send you a tray at mealtimes, and it will be your job to measure your liquids by using the small medicine cups provided. All of your liquids must be measured and recorded on your tracking form, which will be provided by nursing. Your goal is to start slowly with 1 to 2 ounces an hour, each measuring cup being 1 ounce, and gradually working up to 4 ounces or 4 medicine cups each hour before you go home. Important points to remember are to sip your liquids slowly. Do not chug or gulp your liquids, as this may cause pain or discomfort. If this happens, you are most likely drinking too much or too fast. Also, remember that you are no longer permitted to use straws or drink carbonated beverages at this point, as this will introduce air into your small stomach pouch, which can also cause pain or discomfort. Caffeine will also need to be limited, as it is a diuretic and can cause you to become dehydrated. The second day after surgery, you will continue to drink clear liquids. On the third day after surgery, as long as you are at home, you can begin to add high-protein full liquids to your diet to maintain adequate protein intake. This consists of protein shakes, yogurt without chunks of fruit, strained cream soups, and skim or 1% milk. You will continue on the liquid diet for a total of 2 weeks. After 2 weeks on high-protein full liquids, you will advance to a blenderized diet. This is the addition of foods that are blended to the consistency of applesauce. You will need to have a small food processor for this stage. You will also be able to eat soft, non-blended foods such as scrambled eggs or egg beaters and cottage cheese. Initially, you will only be able to eat 2 to 3 ounces of food at one time, which is about 1/4 of a cup. You will stay on the pureed blended diet for 2 weeks. After the 2 weeks of liquids and then 2 weeks of pureed food, you will advance to a soft, solid diet. At this time, you may add soft foods, which consist of moist, baked, or grilled meats, such as chicken, turkey, fish, and lean ground beef, lean deli meats, tuna, low-fat cheese, soft cooked vegetables, light canned fruits, and soft, fresh fruits without skins. Remember, from this point on, you will need to concentrate on the quality of your food selections. This means avoidance of any sugar, concentrated sweets, and refined white flour foods such as white rice, white pasta, white bread, and snack chips. The soft stage will last for 1 month. Once you are 2 months post-op, you may progress to foods of all textures. Your long-term diet and nutrition plan are the rules that you must follow to be successful. If you do not follow the rules, you will either be sick, will not lose the expected amount of weight, and at some point will begin to gain your weight back. To understand the eating behavior changes that you must make, you must understand how your surgery works. So just to review, with a sleeve gastrectomy, we are removing a large portion of your stomach, limiting the volume of food you can eat at one time. You will still have your pyloric valve, which is indicated on the picture as pylorus. This is a muscle that lets food pass from the stomach to the intestine. With a bypass, think of your new stomach as a funnel, a holding pouch with an opening, that will let the food pass from your stomach to the intestine. The bypassed part of the stomach and intestine still function to deliver digestive enzymes that will travel through this area, see the green arrows on the slide, and mix with the food through a second opening that is created as shown on the slide where the black arrow is. Keeping these points in mind, we will now discuss the rules. The first rule, that you must eat 3 meals and 1 high-protein snack a day, is very important. Your goal is to eat about every 4 to 5 hours. You will not have hunger driving your eating, therefore you must eat even if you are not hungry. Remember, you only have a small stomach now, and if you do not eat your scheduled meals, you will not be able to get enough protein and nutrients to keep your body healthy. The other point to remember is that we are giving you volume control, meaning restriction of how much food you can eat at one time, not how many times a day you eat. Grazing or frequent snacking can lead to poor weight loss or regain. Also, when you are back on a solid diet, you should always choose solid foods at meal times. Liquids empty your stomach faster and do not create the effect of fullness. Rule number 2 is to eat slowly and chew foods well. Remember, your new stomach cannot mix, turn, and break down the food as well as your normal stomach. Therefore, this all has to happen in your mouth. Take small bites. Chew each bite at least 20 to 30 times. Poorly chewed food is difficult to digest. With gastric bypass, it may also block the outlet between the stomach and the intestine. Not chewing food thoroughly is a common cause of vomiting. Rule number 3 is to learn to listen to your body. Stop eating at the first signs of fullness. New feelings of fullness will be pressure in the center of your rib cage. If left shoulder or esophageal pain develop, stop eating immediately. This is a sign you have overeaten. Overeating can cause nausea and vomiting. Rule number 4 is to not eat and drink at the same time. Drinking with your meals will liquefy the food faster, thus allowing the food to empty the pouch faster. This can increase the amount of food that it takes to give you a full filling. Drinking with meals can also cause dumping, as it forces the food into the intestine too quickly. If you drink right after a meal, it can cause you to vomit. You will need to stop drinking 30 minutes before a meal and wait at least 30 minutes after to drink. Rule number 5 is to not snack between meals. Again, remember, your surgery limits how much you can eat at one time, not the number of times. Eating snacks, especially refined carbohydrates like cookies, chips, and pretzels, is one of the major reasons for weight loss failure. These foods liquefy quickly and empty your new stomach pouch quickly also. Rule number 6 is to eat only good quality food. Since you are only able to eat small amounts, your choices have to be as healthy as possible. Always try to eat your protein food first, followed by fruits and/or vegetables, and then whole grains. This means there is no room for refined carbohydrates and empty calories. Protein goals are for a minimum of 60 grams per day. You will be taught how to count grams of protein at your post-op follow-up visit. Rule number 7 is to be careful with fibrous foods. Foods such as corn, asparagus, celery strings, and the skins on fruits and membranes of an orange may have many fibers that are difficult to digest. They may also block the outlet of your stomach if you have had gastric bypass. The key to tolerance is to be a good chewer. Rule number 8, drink plenty of fluids each day. Your goal is to drink at least 8 cups of liquids per day. Your body needs adequate fluid to flush waste products from your body and to prevent dehydration. Remember, you will need to drink constantly through the day to meet your fluid needs. Rule number 9, drink only non-carbonated low-calorie liquids. Liquids pass through the stomach pouch quickly and do not give you a feeling of fullness. Empty calories in your drinks can add up quickly. Avoid beverages with more than 10 calories per serving, such as regular iced tea, fruit juices, milkshakes, sweetened coffee drinks, and alcohol. And remember to always avoid carbonation, even if it is a low-calorie drink. Alcohol is discouraged after surgery. Not only is alcohol high in empty calories, it is also absorbed more quickly due to your surgery, and you will feel the effects quicker and for a longer period of time. A small amount of alcohol could cause you to become very intoxicated. Alcohol can also cause gastric irritation, liver damage, and dumping syndrome. And lastly, rule number 10 is that you must take vitamins for the rest of your life. It is not a choice to stop taking the recommended vitamins and minerals. We will talk about specific vitamins in a few minutes. Exercise, along with healthy eating behaviors, is also key to your success. We recommend that you try to get a minimum of 150 minutes per week. It does not have to be all at once and can be 15 minutes at a time. We do understand that most of our patients have physical difficulties that limit activity, so start slowly. Any kind of movement will help. The last thing that we have to discuss is potential nutrition complications. We have already discussed some of these because complications generally happen because you did not follow the rules. Dumping syndrome is more likely to happen with gastric bypass. However, some sleeve gastrectomy patients do experience this reaction. Dumping syndrome is caused by consuming simple sugars, large amounts of refined carbohydrates, and fatty foods. It can also happen from drinking with meals or consuming alcohol. With gastric bypass, your stomach is similar to a funnel. Dumping syndrome is caused by any food that empties your stomach pouch quickly without being digested. If you think about ice cream, by the time it gets to the stomach, it is liquid fat and sugar. It will empty through the opening in your funnel into the intestines very quickly. The intestine will pull fluid in to dilute it, causing swelling and cramping. Nausea, vomiting, and diarrhea may also occur. Hypoglycemia, which is low blood sugar, can also be part of the dumping episode due to exaggerated release of insulin for a smaller amount of food. This will result in feelings of flushing, rapid heartbeat, and lightheadedness. Nausea and vomiting can be caused by eating too fast, not chewing foods properly, eating too much, drinking with meals, advancing your diet too quickly after surgery, and eating foods that are too dry. If any foods are going to make you sick after surgery, these foods would most likely do that. Try to introduce one new food at a time. This may help identify foods that are not well tolerated. Red meat, such as steak or pork, are typically harder to digest. Foods that are dry or overcooked, especially meats, are hard to tolerate, so make sure you use moist methods of cooking. Gummy or sticky foods, such as pasta, rice, or breads, have a tendency to swell in your small stomach and can form dough balls and make you feel uncomfortable. And we already talked about dumping with high sugar or greasy foods, and fibrous foods may block an outlet. Occasionally, a lactose intolerance can develop since lactose is a natural sugar. Dehydration is generally due to not drinking constantly between meals. Since your pouch is very small, it is hard to catch up on your fluids if you have gone all day without drinking. Many people only drink at mealtime and have a hard time remembering to take fluids in between meals. Drinking excessive amounts of caffeine, because it causes your body to lose fluids, and prolonged nausea and vomiting can also lead to dehydration. Diarrhea is caused typically from eating foods that lead to dumping syndrome, such as fatty foods, simple sugars, lactose, and fruit juices. Large amounts of sugar alcohols, which are artificial sweeteners that are found in sugar-free products, can also cause diarrhea, gas, and bloating because they go through your system undigested. Constipation is common in the early months after surgery when you are only able to eat small amounts of fiber. Inadequate fluid intake can also lead to constipation. You may need to take stool softeners or a mild laxative. Gas is caused by eating too fast, drinking through straws, chewing gum, eating gassy foods, which you may have a more noisy digestive system after surgery, lactose intolerance, sugar alcohols, and carbonated beverages. Protein deficiency would be caused most often by poor food choices. Concentration on eating your protein-containing foods first at meals is very important. Liquid protein supplements are necessary until you are able to eat adequately. Hair loss is caused when you have major surgery and from the anesthesia itself. This usually happens during the phase of rapid weight loss right after surgery due to marginal calorie intake. You will generally not notice hair shedding right after surgery, and this may begin when you are about 3 to 4 months out. Maintain adequate protein intake, and taking your vitamin and mineral supplements will help minimize hair loss and promote new growth. And lastly, vitamin and mineral deficiencies are most often seen in those who are not compliant with their supplementation. Because your new stomach is very small, it is more likely that you will not be able to consume adequate amounts of food. This is why it is very important to always take your supplements after surgery. You will also have some degree of malabsorption. With gastric bypass, the part of the small intestine that is bypassed is the preferred site of absorption of vitamins and minerals. Also, the new stomach pouch produces less acid, which is needed to help with absorption. The vitamins and minerals you will have to take are a multivitamin, initially in a chewable form, and it should be comparable to Flintstones Complete. This multivitamin you will take twice a day. You are not allowed to have gummy vitamins due to the lack of iron and some of the trace minerals in them. You will also take B12, which you will have a choice of taking by mouth daily or as an injection every 3 months. We do recommend sublingual B12 if oral, as these melt under your tongue and are absorbed more efficiently. And you will also take calcium, initially starting with a chewable form, such as Ultra Tums 1000. This you will take 1 tablet twice a day, and then at 2 months post-op you will need to switch to calcium citrate with vitamin D as your long-term calcium supplement. This calcium you will take 2 tablets twice a day. Calcium citrate is a form of calcium that is better absorbed because it requires less acid. There is one other complete multivitamin and mineral supplement that is available. Bariatric Fusion is complete, meaning that it is the only supplement you will have to take. You will need a total of 4 tablets per day. This is available online at the above website, or there are a few pharmacies in the area that have it in their locations. If you are interested in this product, you can discuss this with a nutritionist at the time of your post-op visits. And that concludes our workshop.